I always have to check my Facebook to make sure that we are live. I have no better techniques to find out if we're live or not.
You know more than I do. I don't even know how to do that. So I'm glad you're navigating this.
We shall survive. Yes, we are live. Hi, everyone. Hello, hello, hello. Welcome. Come on in. Come on in. Get comfortable. Get settled. We're so glad that you're here for our very special Facebook Live. So, whether you are joining us in person live for our stream or you are catching us on the replay on demand, your presence here makes a difference, and your presence here makes this space so much better. And so we're so thankful that you're a part of this conversation. And so, with that being said, be sure to say hello in the chat, leave a comment. We will open the floor up for questions kind of towards the end. So we're kind of going to have a little discussion, and then towards the end we'll kind of review your comments and look at some of your questions. My name is LaJune Johnson. I'm a licensed clinical social worker. I'm also the founder and CEO of Therapy Plus. Today's conversation is certainly a special one. We are talking about mental health, and we're honing in on having a conversation about children's mental health. And, our hope is that having this conversation will help us normalize addressing issues early and building the foundation for lifelong emotional well-being that starts in childhood and beyond. And so we definitely want to destigmatize the conversation around mental health, and certainly we feel like that means having these kinds of conversations early on. So again, welcome. We're so glad that you are here. Tonight, we have a very special guest that's joining us in this conversation. Today, I'm just giddy that we have Dr. Nalima Duncan, licensed psychologist, with us today. And I'm going to definitely let her open up the floor and kind of share a little bit more details about herself with us. But I will preface that by saying she is definitely all the things. She is, wonderful mom, great wife, exceptional professional. So I'm going to let her kind of share a few more details about herself with us today.
Thank you, LaJune, for having me today. I'm so excited to be here. Talking about kids and mental health is my passion. And so I'm super excited to be with everybody today to discuss this further. So like you said, I'm a clinical psychologist and I'm also a behavior analyst. And I was trained in actually a school psychology program, so I have a lot of experience working in school settings as well. And I have two different branches of my clinic. So one is the psychological services where I do diagnostic testing, and then I also do some therapeutic sessions in the clinic. And then I have another branch of our clinics, which is Blue Sky Behavior Therapy, and that entity provides applied behavior analysis services for children who have a diagnosis of autism. And so that is the two big things that pretty much take up my life, other than my children and my family. And so that. So I've been around for about, our company has been around for about 7 years, and we're just steadily growing and trying to reach more people as we grow.
I love that so much. And, I always like to ask folks, kind of what inspired them to delve into the career that they delved into. I feel like most of us that are kind of in this space have like a why that is pretty big. And I know for me, what it inspired me to kind of go into social work was having an autistic brother, and then also, having exposure to social workers having such a positive impact in our life, coming in and providing our family and empowering our family with resources and services that not only helped him kind of navigate having autism. It helped my mom, of course, but also helped everybody in the family. And so I remember that feeling and saying, oh man, if I could do that for someone, that's something I want to be able to do, something I envision myself being able to do for the rest of my life. So just curious, like what inspired you to, focus your career on supporting children's mental health and being involved in behavioral health?
Yeah. I always say that I fell into it accidentally. I was always interested in psychology. That has been something that, like how the brain functions, the neurology of it all. Like I've always been interested in that. And so I was a psychology major when I was an undergrad, and I really loved it. And I needed a job over a summer. And so I decided to apply for a job working with a clinic that provided ABA services for children with autism. I did not know what autism was. I did not know what ABA was when I got into this role. And this was back in 2003. It was a little while back. But immediately, like as I started that job, I fell in love with it. And so that changed the course of my, direction. I was going to try to go to medical school. And then I was like, nope, that is not the route that I need to take. This is the route that I need to take. And so I went into school to become a psychologist, and then continue to work with children with developmental disabilities mostly.
I love that. I love that so much. And thank you for sharing that. Thank you for sharing that with us. So I really wanted us to kick things off and kind of ground our conversation. I love pulling like statistics. Like I love pulling facts from, because I feel like that helps kind of ground the conversation. Yeah. And I know I wanted us to kind of start with talking about the landscape of children's mental health right now. So I did pull a statistic from the National Alliance on Mental Illness, which is NAMI. So most of us in this space are familiar with NAMI, very reputable organization. But NAMI offered a statistic that 1 in 6 U.S. youth aged 6 to 17 experiences a mental health disorder each year, and half of all mental health conditions begin by age 14. They name ADHD, anxiety, depression, and other behavioral challenges identified as the most commonly diagnosed, yet nearly half of youth with these conditions don't receive treatment. Mm-hmm. Given those numbers, and from your perspective, what does the current mental health landscape look like for our children today?
I think there's a couple of different dimensions to this. So I think over like you said, just the statistics that we know over the past few years, we have seen a significant rise in these mental health concerns and conditions, right, and among children. And there's a lot of different things that probably led to these challenges more recently. We have had the pandemic that resulted in a lot of social isolation, or maybe even challenges with academics and learning, because children weren't in school like we typically are during that time. And then we also have a big rise in use of social media by children, and so that also has resulted in a lot of mental health challenges, specifically older children, like middle school and up, where they are more engaged with those social media platforms. We're seeing more challenges with children being able to manage their emotional well-being and things like that. But on the other side of this, while we are seeing this rise of these mental health challenges, I think we're also seeing that these mental health challenges are not as stigmatized as they were a few years back. I think parents are becoming more aware, families are becoming more aware of these challenges, and are trying to seek that professional help a little bit more than what we noticed, or what I had seen before. And so I think that aspect is great, that we are slowly but surely destigmatizing mental health challenges and increasing that awareness for that. but
But
then
then
the
the
other
other
aspect of
aspect of
it
it
is
is
access to
access to
care,
care,
right?
right?
Like
Like
now
now
that we
that we
are
are
noticing
noticing
that
that
these
these
challenges
challenges
need to
need to
be
be
addressed,
addressed,
and we
and
are
we are
noticing that
noticing that
there's
there's
less
less
stigmatization,
stigmatization,
access to
access to
care is
care is
still
still
difficult,
difficult,
especially in
especially in
Mississippi.
Mississippi.
We
We
don't
don't
always
always
have
have
those
those
adequate
adequate
resources that
resources
these
that these
evenings
evenings
one
need,
need, specifically in
specifically
those
in those
rural
rural
communities.
communities.
And
And
early
early
identification
identification
tends to
tends
be
to
a
be a
challenge
challenge
because of
because of
that as
that as
well,
well,
because
because
they're
they're
waiting
waiting
on
on
wait
wait
lists to
lists to
get
get
diagnoses
diagnoses
and
and
or even
even
treatment
treatment
purposes.
purposes.
And
And
so
so it just
there's a
there's a
lot of
lot of
different,
different,
there's some
there's some
positives
positives
with
with
this, and
this,
then
and
there's
then there's
some,
some
obviously,
obviously
some
some
things that
things
we
that we
still need
still
to
need to
address
address
on
on
our
our
end.
end.
Absolutely. And wow, you touched on so many different layers that I hadn't previously kind of thought about. But yes, like I am one of those mamas that thank God that social media wasn't around when I was coming up. Like when I look back, I got my first cell phone at 21. Like I was 21 years old when I got my first cell phone. And I think Facebook came out when I was like sophomore year in college. So, and it was a big deal. Now, fast forward 20 plus years, we got not only Facebook, but a variety of other platforms that kids can go and navigate. And I'm just like, oh my goodness, I'm so thankful this wasn't around when I was coming up because talk about I don't know what kind of choices I would have made. And you know that's heavy for a lot of children to grapple with. I was just thinking about cyberbullying that wasn't around when I was coming up, right? And then also I know I've read a lot of studies talking about how young girls are dealing with a lot of body image issues and self esteem issues because of what they are idealizing as beauty standards in today's society. Whereas, we didn't have those types of societal pressures, when we were coming up. And then also just, and this is something I have to manage as an adult, is just, having your device glued to your hip and constantly checking and rechecking and like children having to deal with that. It's hard for me to deal with as an adult. So yes, I mean those are definitely things generational wise that we didn't have to navigate, nor our parents had to navigate. And so we as parents are now trying to figure out parenting in this new era, digital era, may I say. So yes, that is particularly hard because it's like unrealistic to think that our kids aren't going to have a device, right? Like, but you're going to have a device given today's societal, like where we are in society, but how do we manage you using this device responsibly? How can I make sure that I am parenting you responsibly while you have this device? Because having a cell phone is a pretty powerful um, it's a pretty powerful thing to have access to. So yeah, definitely, definitely. And then thank you too for bringing up, just access to care and how important that is, particularly for us in Mississippi, where because we are a mostly rural state, um, accessing care can be difficult. And then we are a state that also, we have a lot of folks who are Medicaid recipients. And unfortunately, we have a lot of providers that, for whatever reasons, aren't able to opt in to be a Medicaid provider. And so, you know, instead of traveling 30 minutes to see your provider for mental health access, you may have to travel 2 hours to go see a provider because they're the only provider nearby that accepts Medicaid. And so that can be certainly challenging as well. So I really appreciate you. That was, yeah, multi layered. I really appreciate that whole conversation. For sure. So when we think about, developmental and behavioral conditions or disorders, I know we've kind of talked about the broader landscape of some of these external stressors that children are having to navigate, having had a lot of their developmental years in the pandemic era, which came with a lot. And then also, the societal pressures of having social media platforms accessible to them. I want us to also take a look at specific conditions that may be showing up most frequently in the clinical and school setting. But I wanted to offer a disclaimer. We are not here to diagnose anybody.
Nope. No.
We're not here to diagnose anybody. So in turn, we're gonna tell y'all: do not go back diagnosing your kids. Don't go back home diagnosing your grandbabies and your nieces and nephews. We're here to knowledge share. So, and we want you to connect with the information in a way that resonates with you, and we want this information to certainly be empowering for you. So, connect with it in that way. Go back and ask your provider questions. Do your own research. This is meant to empower, not to diagnose. Mm-hmm. So, with that being said, we know that many families who have small children who may be entering the educational space, right? Maybe navigating or having concerns about things with their children, like maybe lack of attention, impulsivity, hyperactivity. Maybe their child is not meeting developmental milestones that are considered typical or normal. And so that may be, a concern for parents. I've been in that boat for sure. So with that in mind, maybe let's talk about some of the conditions that you see most often in your experience or your practice, whether they be ADD, ADHD, autism, and maybe just talk a little bit about how they typically present in children or what parents should be kind of looking out for.
Yeah, absolutely. Thank you for providing that disclaimer. I completely agree. This is not a diagnostic thing. Whenever we're doing a diagnosis, it's a multifaceted process. There's a lot of components that go into it. Simply recognizing signs and symptoms is not going to be enough to provide that diagnosis. But in my practice, some of the common conditions that I typically see are, or tend to end up like having families come in questioning, does my child have ADHD or autism or any type of learning disability? There's been instances where anxieties also popped up, but mostly it's ADHD, autism, learning disabilities are the big things that I typically see. ADHD, often presents itself as difficulties with attention, impulsivity, hyperactivity. Whereas autism is like different. Obviously, there's more that I can say about it, but to truncate it, varying degrees of social communication challenges, maybe excesses in the areas of repetitive behaviors and restricted interests. Those are things that you can typically see with an individual who qualifies for a diagnosis of autism. I think mostly it's important for families to know that these conditions are neurodevelopmental, right? Which basically means that it's a brain development, and the way it's functioning is not functioning as what you like typical. But each child is unique, and the way that each of any of these diagnoses look for each child looks different, right? Like one child with autism is only one child with that, those types of symptoms of autism, and another child is going to present that autism diagnosis in a different way. Similar to ADHD as well, there might be some strengths that a child with ADHD has that are unique to that child, and some strengths that another child has that are different for that than the other child. So I think key with this is just recognizing that there are they're varying degrees, and sometimes they're subtle. Autism is called autism spectrum disorder because there's a larger spectrum. So we have subtle social behavioral challenges to more extreme, like challenging behaviors and self-injurious behaviors that come up. So we do sometimes when we're seeing the subtle things, sometimes they get missed because they are so subtle and they're maybe not really super challenging. And then sometimes we, similar to ADHD as well, we sometimes see that being missed because of the subtle differences.
Mm-hmm. And thank you for highlighting all of that. And I know you were talking about the subtleness of ADHD, and one of the things that I was looking into, well, having a child that has ADHD, you immerse yourself in the literature to, okay, how can I better identify with my child? How can I better understand? How can I better? And so, yes, you immerse yourself in the literature so you can better understand, better parent too. And so, in my just research, I was reading some literature that was saying that, when there is an ADHD child in the home, there is an increased likelihood that one or both of their parents has ADHD. So then I went through this whole thing, like, which I was looking at my husband like, well, which one of it is? Who is it? Is it you or I? Who has the ADHD? But I was like, what I learned about ADHD being in the mental health space, I never associated it with me, with myself. But I did learn that some of the common traits that are found in girls don't present as typical ADHD characteristics. And so I just wanted to ask you, and that girls are better at masking some of the symptoms of ADHD as well. So I wanted to kind of just follow up with you about that conversation about how it can be missed in childhood. Because I know that we're also seeing an increase in adults being diagnosed with ADHD as well because of it being missed in childhood.
Yes, absolutely. So ADHD can often go undiagnosed for girls typically, and that might be true for ASD as well, autism spectrum disorders as well. And so because the symptoms are less obvious, boys tend to be exhibiting more of those like hyperactive tendencies, and so whenever or impulsive tendencies, and whenever you're seeing that, those are more noticeable, right? Like they're more disruptive. And teachers are more apt to say, "Hey, I need you to go and get this checked out." Because they're more overt. Whereas girls, their symptoms are more, I think, internalized. So they show up as like maybe inattention or like daydreaming or just being kind of quiet and not really disruptive. And so if you're not disruptive, you're not going to get the teacher's attention in the same way that a child who is disruptive is getting that teacher's attention. So girls do tend to and in addition to that, girls do tend to mask their symptoms better in social settings. Again, that's the case for ADHD as well as autism spectrum disorder. You do tend to see that masking happen, and so that does tend to delay that diagnosis to adulthood, like you were talking about, and then later in life, these individuals are recognizing, okay, maybe I have been struggling with this all my life, and I didn't even know it. And so sometimes those challenges, as you get older, they may get compounded, right? Like the harder and harder, like your schooling gets, or your life as you're going into college, you start to notice that a lot more because there's more pressures that you have around you, whether it's work or education, whatever it is. And so you tend to notice that later in life.
And thank you for sharing all, because in my research of going down the rabbit hole, I did not know that about autism disorder, that girls typically tend to do better with masking autism conditions as well. So that is so interesting. And speaking about autism, I have a special connection to autism just because I think I shared earlier on the call that I have a brother that has autism. And I know that, recently there's been a lot in the media about autism because CDC has recently issued some more data around, just increased rates of autism in society. And I wanted to get your perspective on that. I'm so glad that you mentioned about, your professional background and starting out in the autism realm. And you talked about it being 2003.
Mm-hmm.
And so, my brother was born in 91, and I kid you not, I remember he didn't talk until he was 5. And so that was certainly something that, we all remember.
Yeah.
Like, it's a 7-year age gap between he and I. And I just remember, yeah, he wasn't talking, and my mom being concerned about him going into school because he wasn't talking yet. And I kid you not, I remember when he was diagnosed with autism, and everybody's like, what's autism? What's autism? And it's so interesting now because fast forward 33 years later, most people know what autism is. Fast forward, most people know somebody that has autism or have heard of autism. It's not we didn't know if it was a cancer diagnosis or what. We was like, well, what's that? What's autism? But it is refreshing to see that, that is not something that is like, in today's society. So with that all being said, I'd love to get your perspective on what, in your professional view, what's contributing to the increase in autism diagnoses, across the board.
I think there's a lot of different things. It's hard to pinpoint to one. I think one, we have gotten better at diagnosing in general. We have gotten better at having the right tools. Clinicians have been able to use these newer tools to be able to really identify what the challenges are and then identify those symptoms. So we've just gotten better clinically with that diagnosis. Kind of going along with that, I think often what was happening is that maybe children with autism were misdiagnosed with some other type of developmental disorder, whether it's intellectual disability or it could be an array of different things that they may have ended up being diagnosed with that was not necessarily the right diagnosis for them. And so maybe that was happening more often in the past than it is, now that our tools are better and we have a better understanding of the disorder. And then I think there might be environmental causes. There might be genetic, components to that. We are still doing research on that. They're still developing research. There's nothing significant, concrete to that has been identified for what those components are. There's like twin studies where like a sibling with who has autism could potentially is more likely to the sibling is more likely to have a diagnosis of autism. But that's the same case with any other. Like a child with ADHD, you may have a sibling that might also have a higher likelihood of a diagnosis of ADHD. And so you're going to see that. I think in any of these psychological conditions that we think about. So clearly identifying what the causes of autism are, it's kind of hard to say at this point. But I think diagnostically we've just gotten better, and we are intervening early, and we're getting that early diagnosis so that the children are able to get the services earlier. The other part of it is kind of going along with what you were saying with regards to a lot of individuals get older that are also getting diagnosed with ADHD because they're starting to realize that, hey, that's the same case with individuals with autism too. There's been a big surge in adults being diagnosed with autism, and they didn't know that they had autism as they were growing up, but now that there's more awareness to it, they are able to see that that's maybe what was happening and get the supports that they need in adulthood.
I love that. I did not know that we now had better tools to assess and diagnose for autism. That is amazing. I love that so much. And I also loved just the increased awareness, right? The increased awareness around, what autism is, and having folks who have autism in our communities. I know for my brother, they have a day program that he goes to every day. So every day, well, he's grown now. He's 33, going to be 34 in October. But so he's integrated into his community. So every day he gets up, he goes to his day program. They have things for them to do throughout the day, and they have special events for them and everything. And I love that so much because that's important for our folks, as they who have these conditions that transition into adulthood that may not be able to live independently on their own. Certainly, there are going to be individuals who have ADHD, autism, and AD that will go on and can live independently. But there will be a segment of folks who won't be able to live independently on their own, and my brother is one of them. But it's still important for them to be integrated into their societies and have a sense of self and have a sense of purpose. And he loves going to his day program every day, and it's just so I love that so much, just because I think it also speaks to awareness and the need to have programs and services for segment of folks who want to be connected to their communities and be integrated into their communities. So I love that. I love that so much. I know we talked we had a little segment conversation about the ADHD, and I know I had been talking to you in previous conversations about how ADHD sometimes can be, sometimes our ADHD children can sometimes have an increased risk for also being diagnosed with ODD, which is oppositional defiant disorder. And so I know, for me, oppositional defiant disorder, sometimes it can carry, it can carry like implications about how a child can be perceived, and as a troublemaker or defiant, or some of those negative things, when it's like, no, well, this is the ADHD, let's treat the ADHD. I wanted to maybe talk to you a little bit about how we can more effectively differentiate between a child's having ADHD and not in ODD, and how the ODD can maybe be misinterpreted, and it could be a child's responses to environmental stressors that they may be experiencing. I just wanted to get your perspective on that.
You do tend to see that. And there is a very critical distinction between like ODD and ADHD. I think one of the things to know is like really know what ODD is, right? Like ODD is like persistent patterns of anger or irritability or defiance, sometimes vindictiveness. Vindictiveness is one of the things. So purposefully doing something just to do, and so I think the best way to do that is to get history, get a lot of examples. Like as a clinician, when I am trying to differentiate that, I'm asking a lot of questions of the parent. I'm asking, what is tell me some examples of his behavior or her behavior in this setting. Tell me some examples of what's happening here. And I think getting a lot of examples of that is going to get you more of that information and help you differentiate between ADHD and ODD. Sometimes ADD symptoms do kind of look like oppositional defiant disorder, but there's not that vindictiveness part, or not that persistent patterns of irritability or anger. It's more that they are impulsive. Children with ADHD do tend to act without thinking, but it is not that they are doing it on purpose. It is like a neurological thing. They are just acting without thinking. It is related to your executive functioning skills that are like overhearing or frontal lobe, and they're not as well developed, and they have not had the tools to be able to learn those skills yet. And so you start to see that, but it's not necessarily related to like an overt defiance or an overt vindictiveness when not following instructions. That's another thing, right? Like children with ADHD also tend to have difficulties with following instruction. Not because they don't want to, is that maybe they're just not paying attention to that instruction or missing parts of that instruction. And so sometimes that looks like they're just being defiant, but that's not the case. They're truly not processing everything that's been said to them in that moment. And so sometimes we do see that overlap. So that's why, like, as a clinician, getting a lot of examples of when these behaviors are occurring is going to give us a little bit of a better idea of, is this ODD or is this ADHD?
Gotcha.
Yeah.
And thank you for that. Lots of examples is key. Lots of examples. Honing in on intent and vindictiveness. Thank you so much. And with that being said, like dismantling some of the common misconceptions about what these diagnoses or these mental health conditions mean. What are some of the common misconceptions that you have encountered when having conversations about these conditions, and like what are some misconceptions that are worth like dismantling or expelling that you like to kind of hone in on?
There's a lot. There's a lot of misconceptions about these diagnoses, unfortunately. Just a couple of things to kind of highlight. With regards to ADHD, often it's just people think that hyperactive, right? Like that is the biggest thing. It's not all about hyperactivity. There are also challenges with that inattention, that impulsivity, and then regulating of emotions. Hyperactivity is more noticeable, right? Because we see it, and it's again more overt, like we were talking about before, especially with boys. And so sometimes, again, it's missed because that subtle symptoms or this inattention or that are not as impactful, overtly, is going to end up getting missed. The other thing is, like I was saying earlier, like children with ADHD may not be following instructions because they are not necessarily misbehaving or being lazy or things like that. They are truly not processing all of the information that's been provided to them in that moment, or missing parts of the information, or so focused on something that they're doing that they are not hearing what is being said. And so it's important to know that children with ADHD do have challenges with like organization and planning and emotional regulation and time management. All of those things kind of go into those executive functioning skills that children with ADHD might be struggling with. With regards to autism, one of the misconceptions is that all children with autism are nonverbal or don't talk, or like I said earlier, every child with autism experiences it in a different way, and so experiences those symptoms in a different way. So children with autism may not have language delays and can communicate really well, and then while others have significant language delays, and so it's again, it's on that spectrum, so we can't identify it as that. The other thing also is, with regards to autism, is that people think that children with autism don't want to socialize, and that's why they don't. They don't want to be social. They don't want that. But that's not the case. They want to engage in those social interactions. They may just not know how to approach that. And so they may have difficulty identifying like social cues and body language and understanding social norms and stuff like that. But that's not a lack of want. It's just like not being able to exactly know what to do in those situations. So I think that's important to know with those two things. I'm trying to think of with regards to like learning disabilities. I think People think that children with a learning disability are not smart, quote unquote. And that's not the case. Actually, oftentimes children with learning disabilities have average or above average IQ scores and cognitive scores. They're just struggling with something specific, some specific academic skill, whether it's reading, like dyslexia or dyscalculia, which is like math challenges with math, but they may be really good at something else. They may be really good at like other academic areas, and can be successful. So it's not that they're not smart. They're just struggling with some of those academic skills, specific academic skills.
Thank you. I learned like a lot in this conversation, this segment piece that is talking about dispelling or dismantling misconceptions, because I didn't know a few of those, even being in the mental health space. So just for folks who are not in the mental health space, I can only imagine. I remember looking at the diagnoses in the DSM for autism and reading about how poor socialization or lack of socialization skills was something that was a common trait with autism. And I remember thinking to myself, well, that doesn't fit my brother. He's like one of the most popular people in our community. He is a pretty popular person in our community. Everybody knows him. Everybody's honking the horn, waving at him. I was like, well, that part doesn't really fit him. But thank you for dispelling that. Like, it's not a one size fits all kind of a situation. And even with talking about the learning disabilities and saying like these children can be exceptionally gifted and extremely talented, especially in something, a particular skill set or something that they're passionate about or is of interest to them. So that is also good to know as well. So I'm so glad we touched on that. So building on what we've kind of been talking about, I did want us to kind of touch on how early intervention support services can change a child's developmental path or their quality of life. So I did want to kind of, us to kind of touch up on that maybe a little bit. You maybe share a few tidbits.
Yeah. I mean, the earlier the intervention, the greater those positive outcomes that a child is going to have through those therapeutic services that the child is receiving, right? When we think about early childhood, that's where a lot of that brain development is happening. And so there's a specific psychological term that's called like the critical window that's happening in those earlier, like the toddlerhood and stuff like that. And so that is when the brain is like most adaptable and responsive to intervention. And so the earlier that we can get a child into services, the better the outcomes are. So I think it's important to recognize that. Also that if we're getting these early services, they may have an easier time once they get into like school-aged, settings. So it could potentially minimize like future challenges that they may have. It can teach them coping skills or problem-solving skills or whatever emotional regulation, whatever it is that the child needs at that point is super important. And then it also like having that early intervention also supports parents, right? Like a lot of like therapeutic having a child with a disability or psychological disorder or something like that can be really challenging for a parent who doesn't know how to address it at home. And so if early intervention is provided, that parent may also be able to get some like some support that they need to be able to figure out, okay, how do I address these challenges that I'm having at home with my child? And so getting those supports can empower the parents as well and push that into a better direction.
Absolutely. Thank you. And you're right. Like early intervention is amazing, not only for the child, but yes, for the entire family, because my viewpoint, having been having a family member that has a disability, it can impact the entire family. Like, we have to all adapt. We all have to have coping skills to a certain degree to kind of navigate the challenges that come along with it. And, I remember with my brother, him not talking until he was 5 years old. When he was introduced into the school setting, the educational care team came in, and they actually had us start to learn sign language. Like, everybody in the family started learning sign language because we didn't know if he was going to be able to talk. So he was learning sign language, we were learning sign language, and then all of a sudden he started talking. All of a sudden he started talking, and he's a talker now. By the way, we laugh about that now. He is a talker, but that preparation stage of, okay, this is how we're going to navigate this. Everybody has to be on board, and really preparing the entire family with intervention or coping skills or tactics, or how to navigate having someone in the home who is going through or who is diagnosed with a mental health condition. So yeah, early intervention is definitely amazing. I know that evaluation and testing is also a part of the larger conversation when it comes to early intervention. Is there a age when testing may be too young, or intervention is too young, or what is the consensus or the professional vantage point on that?
So I think it depends on what condition is being assessed, right? Like where we're going with that. So if you think about ASD or autism spectrum disorder, like really you can often have diagnose a child and test the child at 18, as early as 18 months, in some cases. And so it's for autism, there's that earlier piece, and it's helpful to be able to get that diagnosis at that age. That way they can start to receive those early intervention services. And often, looks like lack of eye contact or limited social engagement, or again repetitive behaviors, things like that. You can start to notice those symptoms as early as 18 months. Whereas ADHD is a little different. So you can diagnose as early as like 4 years old or so, but really it's more reliable after the age of 6, or when the child has started school. Because of a lot of different things. So it can be really tricky to diagnose like a preschool age child with ADHD, because young children are still developing those skills, that ability to focus and to regulate their behavior. They're still learning. They're in that learning phase. Control their impulsivity. Like all of those things are again, early stages, right? So we want that child to be able to have time to develop certain skills like that, to be able to appropriately distinguish, is this ADHD, or are we just still learning? And so if we're trying to diagnose really early for ADHD, it's a challenge, and we may end up misdiagnosing at that point. So sometimes waiting and seeing if those symptoms are persistent and are really impacting that child's functioning at home and at school, that's got to be a big critical factor with ADHD. How significantly is it impacting their school or home? That's going to be a qualifying indicator for diagnosis.
Great.
Or one of qualifying indicators.
Sure. Absolutely. And I love what you shared about, like, it's a multi-layered, kind of a situation to assess, and you have to take into consideration what we're dealing with. Autism, ADHD, ADD, other behavioral disorders, all of that has to be taken in consideration when we're talking about testing and evaluation. So if a parent suspects that their child may need testing or an evaluation, what do you think would be their first step, or what would be a first step for them?
One of the first steps always is to talk to your pediatrician or your primary care provider to see, one, you want to know whether your child is meeting those developmental milestones like we were talking about earlier. And so that's the pediatrician is a really good place to start to see is my child meeting those developmental milestones or not. And then either they can refer out to a specialist or a pediatric psychologist or developmental pediatrician or something alike, to be able to do to get an assessment done. But it is also, I want to also preface it that you do not need a referral. A pediatric psychologist typically don't need a referral from a pediatrician to be able to conduct an evaluation. So if you're finding that maybe your pediatrician is saying, let's just wait it out, let's see how that, how he or she grows out of this, or whether they'll grow out of it, and you're like, no, I really want to go ahead and get them evaluated. You can get them evaluated. You can contact a pediatric psychologist, and they will, assess and see what's going on and give you more, feedback on whether that child meets that diagnosis, or here's some tools and tips that you can use and teach these skills, and then maybe come back a year later and let's see where we are. So there's just options for that.
Yeah, and thank you for that. Just talking about, a waiting period maybe to see, okay, this may be, a part of their growth trajectory, their developmental trajectory. They may grow out of these behaviors. And then knowing that, hey, there are tools, there are options for you to explore before we delve into testing, which I think is pretty awesome as well. So just for parents to know that, or educators, well, I know, I'm sure educators already know that, but some parents may not know that there are avenues to explore before we delve into testing. And with that in mind, I think, it's my hope that, I know we'll probably have a good number of mental health professionals on the call or to watch us on demand, but it's definitely my hope that we also have, educators join or watch, or parents, caregivers, anyone who comes in touch with, children. But for those of us who are working directly in the mental health space with children, from your perspective, what are some maybe training tools, approaches available to help professionals recognize and maybe reduce diagnostic bias, or maybe you can maybe talk about, diagnostic bias when it comes to ensuring that children receive like equitable, culturally informed care when it comes to the mental health space?
Absolutely. This is such an important topic, and I think we're still, as a mental health field, we're still growing and slowly getting better at this as well. It's super important for us to recognize that there are diagnostic biases around, and we need to recognize that in ourselves as clinicians. Diagnostic bias can result in misdiagnosis or delayed treatment, or even like failure to identify that there is a challenge altogether, that there is a condition that we need to address altogether. On the other hand, it can disproportionately affect children from, like marginalized groups, low-income families, or children with disabilities. There's just a lot of disproportionality that could happen with this. I think the best thing, and I think a lot of again, like I'm saying, like mental health professionals are engaging in this. We just need to do more. I think a little bit more. But like undergoing training and like cultural competence, ensuring like understanding how culture and race and socioeconomic factors can influence behavior and those diagnoses. Like it can really impact those. Sometimes we may, as clinicians, have an implicit bias that we're not necessarily recognizing that we have, and really like looking deep and noting those, what are my implicit biases and how are they coming up in my clinical practice, is going to be really important, so that we can ensure that all children, regardless of background, have that equal access to diagnostic services and treatment options. So I think, and sometimes we, when we think culturally, like, we have to consider what is typical behavior for this culture, right? Like, or this population, or this, and so sometimes what is typical behavior in that, setting might not necessarily match up with the DSM-5 criteria, or vice versa. And so it's important to recognize all of those things when you're making those diagnoses.
Absolutely. And thank you so much for just the conversation about cultural humility, right? That should be a lifelong, for those of us immersed in the work, that should certainly be like a lifelong, infused into our professional goals, like every year, to immerse ourselves in the work, to take training, to recognize our own implicit biases, because we all hold them. And so we definitely need to be proactive to make sure that we address them and are culturally informed. And so thank you. I really appreciate the conversation around that. I think, I want to definitely end on a positive note in just talking about support and empowerment for families before we wrap up. So I would love for us to maybe end on just talking about ways that parents can empower themselves when they're navigating the challenges of maybe parenting a child who may be experiencing behavioral or learning challenges at school or at home, or even if their parents are navigating a space of uncertainty around that, because even that, just the uncertainty can be very challenging for parents.
Yeah, I think you mentioned this earlier. You said when I started looking into it, I did a lot of research, educated myself. That's what you were saying, And so I think that is where a lot of that is going to be helpful for a parent who is seeing these, like educating themselves, finding the right tools and sources that are legitimate sources, that have accurate information, because there's a lot of inaccurate information on the internet. And so I think it's going to be the key, finding the right professionals that are involved with your child's care is going to be super helpful. The other thing is also building a strong support system. There's a lot of parents that have children with ADHD or children with autism, and finding that group where you can talk to other families that have gone through this process and seeing what have you done, what was helpful, what was not helpful. I think finding those local sources is going to be, or resources can be really helpful. And then when you are navigating like school or navigating just any other like pediatricians, advocacy is the key, right? Like the more the parent is able to educate themselves on the challenges that their child is facing, the better advocate they can be for their child, and the better they can understand their rights or their children's rights in the school setting or the healthcare system. And so I think that's going to be super critical. And last but not least, taking care of yourself as a parent, right? Like self-care is super important. And if you're not able to, manage or take care of yourself and take care of your own mental health as a parent, it makes it harder for you to be an advocate and support, your child. So it's important to take care of yourself first, and then see where you can go with providing advocacy for your own child.
Yes. Yes, and thank you so much for touching on self-care, particularly important and notable because Mother's Day was just what a weekend ago, and it's particularly important for mamas because we tend to take care of ourselves last. We tend to take care of everybody else, and then we're last. And the fact of the matter is, we can't pour from an empty cup, and so we really have to be proactive with making sure, like you said, we're staying on top of our self-care routine and taking care of our mental health. Thank you so much for touching on those things. I wrote them down. Yes, vetted sources, families. Please make sure that the sources are vetted. Look for edu, org, when you are reading material because it can be. There are unfortunately some not so reputable organizations that's putting out information out there that can be harmful for you because it's just not honest or truthful. And then I love what you said about just building partnerships with teachers, your child's teacher, finding supportive networks that you can process things with, because we can learn from our successes and challenges with navigating certain things when it comes to this. And so, I can't believe we have already encroached upon an hour. Amazing. This has been a wonderful conversation. I'm so appreciative of Dr. Duncan for joining us. We're going to put Dr. Duncan's socials in the chat for you guys so y'all can, if y'all not following her or following Blue Sky Therapy, we want to make sure that y'all are doing so because they are certainly amazing. We do not have I don't see any comments in the chat, but feel free to send us questions. We can always follow up with you one-on-one if needed. But with all that said, again, we want to thank Dr. Duncan for joining us and lending us her expertise and her insights and her knowledge. She is amazing. I have learned so much by being on today's live stream, and I certainly hope you all have too. Dr. Duncan, if you want to say farewell, you certainly can.
Thank you. Thank you for having me. I really appreciate you reaching out to me, Lejeune, to have this conversation. The more we talk about it, the better awareness there is. And so while I was scared to do a Facebook Live, I was made it. But it was really a great conversation, and I think an important conversation to have. So thank you for hosting this.
Absolutely. Thank you so much. And okay, guys, thank y'all for joining, and we'll see you next month. Bye.
Bye.